Tēnā koutou, tēnā koutou, tēnā koutou katoa. Ko Pen Blackmore toko ingo. And thank you for this invitation today. It's a pleasure to be here and share our story, and even more of a pleasure to hear some of these other stories, especially from Hauora Heratonga and the Porirua team. So we have lots of similarities, and it's fantastic today to be able to share together. So I'll just let Shane, who's making the difference for us really, introduce himself before I start. Thank you, Shane.
Kia ora koutou, ko Shane Reti toko ingoa. I'm a peer support worker for Pinnacle Midlands Health.
Thanks, Shane. Just pop our little timer on here. Keep us on time. Joe's had the stick out. So the title really is the role that we play as an extended care team for our 4 general practices in the Taupō-Turangi area. We have a fantastic team. This is our team, you can see up there. So we have nurse practitioner, dietitians, quite a diverse team. And we also have a child health team within our extended care team. There's 16 of us. We're lucky enough just to be situated behind general practice. We have 2 large practice, Taupō Health Centre and Taupō Medical Centre, right beside us. And then we have the Lake Surgery and Pihanga Health in Turangi that we support. So where have we come from? I guess we have come from working in silos, and in 2016 we were lucky enough that our DHB gave us a more flexible contract, because we had so much lack of flexibility. We had to do, specifically what the contract said. We had fragmented community services, lack of shared records, but most importantly that we were struggling with was lack of engagement with our high care need clients. And so what has changed is that all our practices, the 4 practices, have all adopted the Health Care Home model. We're really lucky because we've got quite a tight cluster. And Lakes DHB supported a more flexible contract. So in 2016 we got an integrated contract, and we had that flexibility to try something different. And what we did try, we started was that we introduced peer support. And that's when Shane came along, and we became also a lot more culturally competent, safe, and really looked at improving how we were going to support more equity for Māori. We provided healthcare in different environments, so we supported general practice coming out into marae clinics. We have community halls, clinics where we do, which you'll see in Shane's presentations, and also developed a single point of access. So we receive about 20 referrals a week from general practice that come into us. They're triaged every Monday, and then we wrap a package of care around our clients. I guess what the biggest, I think, for myself personally, is the success of our interdisciplinary meetings, and they've actually just grown and become the glue. We had really, I guess Pihanga Health and Turangi led the way with this. They had a strong interdisciplinary team meeting going before we grew that in the Taupō practices, and so they have their GPs and Tuwharetoa Health providers, the community rehab providers, and they had a strong meeting, but we didn't have that in Taupō. But we have developed that. It was a challenge actually getting the to see how it was going to work in Taupō, but what's happened is that we talked to the practices and they have let their lead long-term condition nurse come out over to us, which I think has been a key point, and then our whole team meets with the community providers as well. I guess the ongoing enhancement that we're really excited about at the moment is what we're doing with Te Tumu Waiora, where we're bringing the mental and physical health together within general practice, and we're using a behavioural health consultancy model with this, and we've just employed 3 health improvement practitioners, and we're growing our health coaches to support the health improvement practitioners. So we're addressing those thoughts, beliefs and feelings that are underlying poor health. We're educating general practice teams. Our HIPs are doing lots of short, brief psychoeducation and with the general practice team. And we're just at the very beginning steps of this. We've only been going since July this year, but already we're seeing a huge difference for our clients and building that integration across general practice in the community. And we're also just about to start in Q3 in January looking at developing more pathways in general practice for long-term conditions and mental health together. Our ongoing challenges, and whether we're discussing activities, outputs, measuring outcomes, this is our big challenge at the moment that we're working toward. But Shane, I think, when I think about Shane and what he's done for our service, is that you can start to see some of the program impact, I feel. I'm not sure if everyone agrees, but Shane has come from a lived experience as one of our clients in the team, and he's now, through leadership, he's grown, met lots of his goals, lots of his really inspiring goals, and he's working with our team and our clients in a new way for us, which is having great success. So thank you, Shane.
Ko te aroa te waka, ko te whara tō te iwi, ko tauara te maunga, taupō nui a te roto, ko waka tō te awa, ko nā te rauhoto te hapu, ko nukahau te marae, ko Shane Reti tuku ingoa. Yeah, I don't come from a clinical background. I think I'm what you fellas striving for, to get your patients engaged, and because I was one of those ones that never engaged, been referred plenty of times to Pinnacle from my doctor, but it was always, I'd just say yeah, just to keep them happy. And then work was more important to me than my health. But now I've learned to manage my health and work at the same time. I come from a family of high obesity, diabetes, heart failure. My mum was diabetic. She had a brain aneurysm, died when I was 13. Dad had a stroke a couple of years later. She wasn't there, so said he died of a broken heart. But it was me when I was young. I think I was doomed from the start because I was born 13 pounds. Everybody goes, "You're a poor mother." But no, I was big all through my life, through school, got teased a lot at school, right through to college, finished up at college, went straight to work at the gardens, then the sawmill, stayed there 20 years, just got bigger and bigger at the mill, sitting on my butt, driving around. Yeah. It was, would have been 10 years ago, those pictures. I was at my heaviest. My doctor didn't have a scales big enough, so he put me on 2 of those ones with the round things, and he goes, "Oh, I think you're about 280 plus kgs. Every time I used to see him, I used to go, "If you don't change, you're going to die." I used to think, "Oh, no shit." But I still drank. That's all I used to do, go to work, drink after work, drive to KFC drunk, do the same thing again the next day. On my way to work, stop at the bakery, breakfast. It was just a cycle. Then I woke up one morning, hungover. I just said to my missus, nah, I've had enough. So I gave up drinking then and there. That was 19 years ago. And then my missus seen an ad in the paper, I think, for Pinnacle, Midlands Health team, to go to join the program. I went with her. She was, come on, let's go. And I was going, nah. So I went and sat at the back with my hoodie on. Yeah. And Wendy, our exercise consultant, she always goes to me, I always remember that day. She seen me sitting at the back of the room, my hoodie on. But then I was just about ready to walk out, and my missus dragged me back. And I joined Wendy's in this program for diabetes and CBD lifestyle intervention. And I missed the first day in the post because it was raining. Yeah. I'm sure it was Cyclone Bola or some bloody storm. I woke up, it was pissing down. No, I'm not going. So I went to the next one. Yeah. And then I was real whakama, t-shirt on. And didn't even want to get in the pool. Then the bro, Antonio, rocks up, chips off his shirt and just does a bomb in the pool. And oh shit. So, no, ever since then I've no shirt, yeah, had pools every morning now. But, and I carried on and the bro didn't because we were going every day and then he stopped. And I just about gave up as well. But I thought, no, I've come this far. So I carried on. Because I had lost 80 kgs just from change of diet and giving up drinking. Before I even got down, just starting that. Then I took up swimming, couldn't swim. Then I seen this fella swimming with a snorkel. So I got me one from the $2 shop. But I got up to 3 Ks a day in the end, swimming. So I ended up swimming in the Maori in Napier, because my cousin seen me swimming, so she roped me in. But that was before, that's another story. Yeah. But the more active I got, I started getting pain. It turns out I had arthritis in both hips. So I was on crutches for 3-4 years. Got my hips done. Took the, you usually getting the shortcut version of my story, because I ain't got much time. So I got my hips done. Oops, shit. And see, before I got my hips done, I seen the orthopedic, and he wouldn't touch me until I got down to 150 kgs. When I seen him, I was 213, I think, 200. But no matter what I did, I couldn't go any further, my weight. So my doctor, Natalie, she suggested I get a gastric bypass just to help me get down to the 150 to get my hips done. I didn't want to. Thought I was cheating. But then they said, no, just think of it as another tool in your toolbox. So I did it. Got my hips done. Yeah. It's been a long journey. 19 years. But I've gone from all those pills to 3 now. Got to add another one in the other hand. Because my pastor's still catching up on me. Yep, had my gallbladder out and my neck's buggered, tailbone's still buggered, one leg shorter than another. Liver's buggered, yeah. But I'm alive. And I'm enjoying it. So you can't really see it, but all those spuds is the amount of weight I've lost. Yeah, 10 kg bags of spuds. And then moving to, how long is it? And one of my goals when I started my journey was to get back to work. But I thought, back to work is in the sawmill again. And then I get a call from Bevan, Christmas, 2 years ago, asking me if I wanted a job. And I went, oh, what am I going to do? I got no clinical background. And Wendy said, you are it. What you have done is your experience. So I ended up working with them. And this, I've been doing a lot of stuff with them. This is what I'm on now. I've started a men's group in Taupo, Tāne Takituaki, ki Taupo, men standing together. It's based on the Rotorua one that I go over and kōrero to every 10 weeks, tell my journey. They get the full version, even as they've got the short one. Yeah, but I started it up and we've got support from all these lovely people. I applied for funding to Te Paia Waimihia, just to pay for their pool passes and other things they need. It's one of the cool things we do. Get out on the waka. Our mission values. I think that's what we all need to do. Tāne Takituaki ki Taupua. Kaupapa Māori based 8-week program, targeting male Māori men who have comorbidities, who are at risk of developing comorbidities. It's modelled on the Te Whare Tapawhā. Get our pre-ops, post-ops done. Have pool sessions on a Monday, and on Monday I don't do the clinical side, I get in there with them and swim with them, exercise with them. Have our educators come in and talk to them, but it's fun. They open up with each other. There's no women around, so they talk. Yeah. Yeah. But it's good to get them talking. They're even learning to go to the doctors now and ask questions. They don't just take their pills and go home. Now they're learning to ask, what's that for? Do land-based exercise on Wednesdays, and I was clever. I set that up to coincide with the marae clinic, so that when we're there, they can get the checks done for free. Because I love the doctors from our practices come in and do free health checks for them. Waiting for them to get one in Tirangi. teaching them to cook healthy, Katie. They didn't even know what chickpeas were. Some of them still don't like them. I think they just tried it because we were all there. So we had one last Friday actually, another cooking session with the new cohort, and Katie cooked some mince, put some meat in it. And this was a highlight for them. We get a rotorua, get out on the waka. They were just blown away. Some of them don't even know their own pepeha's. One old fella jumped up, said his pepeha, and he goes, "It's the first time I've ever said that." He had to find out what it was. He didn't even. It all ends up in a graduation, a healthy kai. We had a healthy hangi. The ladies from work made salads with steamed meat, vegetables. But this is the big thing. They're learning to self-manage, like what I'm doing. I still go to the pools every day now, every morning, but I've never done the gym in all these 10 years. Just half an hour in the pool every morning, that's it. That's all you need, half an hour. But yeah, I think my version is healthy homes is. See, I still don't know what it can explain to me, but you gotta really explain it. So to me, I think it's me. Oh, I've got 2 minutes. So yeah, that's it.
Kia ora, Shane.